Hi guys, welcome back to my YouTube channel Basic Knowledge of Human Anatomy. Today we are talking about brain and its covering can be sites of infections. Some infectious agents have a relative or absolute predilection for nervous system rabies, while other affect many other organs as well as brain. Staphylococcus aureus. Damage to nervous tissue may be consequence of direct injury of neuron or glial cell by infectious agent or microbial toxin, or may be consequences of host immune response. Infectious agent may reach the nervous system through the several route. Hematogenous spread by the way of arterial blood supply is most common means of entry. There can also be retrograde venous spread throughout the anastomosis between vein of face and venous cyanosis of skull. Direct implantation of microorganism is almost invariably due to open or penetrating trauma. Rare cases can be iatrogenic as when microbes are introduced with lumbar puncture needle or into a surgical field. Local extension can occur with infection of skull or spine. Sources include ear cyanosis, most often mastoid or frontal infected teeth, cranial or spinal osteomyelitis, and congenital malformations such as meningomyelocele. Peripheral nerves also may serve as path of entry for new few pathogens. Epidural and subdural infection. Epidural and subdural spaces can be involved by bacterial or fungal infection, usually as consequence of direct local spread. Epidural abscesses arise from an adjacent focus of infection such as sinusitis of osteomyelitis. When abscesses occur in spinal epidural space, they may cause spinal cord compression and constitute of a neurosurgical emergency. Infections of the skull or ear cyanosis may also spread to subdural space, producing subdural emphysema. Underlying arachnoid and subarachnoid space usually are unaffected, but a large subdural epidyma may produce a mass effect. In addition, thrombophlebitis may develop in the bridging vein that cross the subdural space, resulting in venous occlusion and infarction of brain. Most patients are febrile with headache and neck stiffness and is untreated may develop focal neurological sign referable to the site of infection, lethargy, and coma, with the treatment including surgical drainage. Resolution of uh, emphysema occur from the dural side. If resolution is complete, a thickened dura may be the only residual finding. With the prompt treatment, completely recovery is usual. Meningitis is an inflammatory process involving leptomeninges within the subarachnoid space. If the infection spread into underlying brain, it is termed meningoencephalitis. The terms are also used in non-infection settings such as chemical meningitis, response to non-bacterial irritants such as debris from a ruptured epidermal cyst, and carcinomatous meningitis. The spread of metastastic cancer cells to the subarachnoid space. Infection meningitis can be broadly divided into acute, pyogenic, usually bacterial, aseptic, viral, chronic, usually tuberculosis, ferrochal, or fungal subtypes. Examination of the CSF is often useful in distinguishing among the various causes of meningitis. related to all that. If you have any question, then you can ask it to me in the comment section. And if you are new to my YouTube channel, don't forget to subscribe my YouTube channel, Basic Knowledge of Human Anatomy. Keep watching, keep supporting.